Hi there, this is Dr. Michael Lebowitz.
And this is Dr. Noah Lebowitz.
And we're here today to talk about some of the chemical triggers of joint pain. We're going to try to make this so it's not too complex for the layperson and not too simplistic for the physician, and hopefully we'll accomplish that. We're not going to talk about the structural imbalances that could lead to joint pain. For that, you should see your applied kinesiologist or other chiropractors really well trained in these things. So we're going to talk mainly about three things today that are pretty common causes of joint pain. The first one we're going to talk about is the nightshade family of foods. A lot of this research originally came from a veterinarian, Dr. Childers. He wrote a book about it, and I've seen it hundreds of times in my practice. So basically, the nightshade family of foods has at least 5 neurotoxins in it. It has alpha-solanine, it has solanine, it has nicotine, it has tomatidine, and it has aubergine. And all of these are inflammatory, especially for the people who genetically have compromised abilities to degrade those. Everybody does to an extent, but very common. I, back 15 years ago, was having lots of pain in my right hip to the point that I couldn't rotate it more than about 10 degrees. My dad had had hip surgery at about that age, and I thought, you know, I'm just headed the way he is. I had this love-hate relationship where I would crave tomato products and crave red pepper products and crave white potatoes. Never craved eggplant, but I would eat them in very high amounts at times, and sometimes I would experience migraines, sometimes I wouldn't experience much at all. But I decided finally I was going to totally eliminate them from my diet. And within a few weeks, my 10 degrees of hip rotation became about 95 degrees of hip rotation. So it really helped resolve things. And Dr. Childers had found that cows who grazed in fields that had some of the weeds being high in some of these nightshade neurotoxins, their legs would collapse. I started doing this with some of my patients. I had one patient with 20 years of foot pain, and it just resolved. And I've seen lots of other patients. I even had one patient, this was very strange, but he was suicidal, and we couldn't figure it out, but we did determine he did have a nightshade sensitivity. So I told him, why don't you go off? I doubt this has anything to do with what you're experiencing. But he was able to turn on and off his feelings of suicide depending on whether he was eating nightshades or not. Back to the old adage that anything can cause anything. You know, some of this is, again, from the solanine, some of it's from nicotine. When you do research, most nightshades were not part of the food supply. You know, if you go back more than 500 or 600 years, a lot of them were used in witchcraft. They were used sometimes as herbs. You know, the fact that one of the most common ones that grow wild is called deadly nightshade will tell you something. They act as acetylcholinesterase inhibitors, and I'm going to let Dr. Noah talk a little bit more about this, and then I'm going to talk a little bit about a product that I personally developed to help with this.
So like my dad mentioned, with alpha-solanine or the Solanacea family, definitely there's some of the more pro-inflammatory foods out there. I mean, some people, due to genetics or total load, are able to handle them, and they have other good beneficial properties. But especially in autoimmune disease, if you think of Hashimoto's, if you think of RA, if you think of psoriatic arthritis, solanines are one of the first things that come to my mind. And you can just go online and read hundreds and hundreds of testimonials of people saying, I stopped nightshades and all of my RA symptoms went away. Which, remember, there can be many different causes, but that can be a major trigger. And it can take a couple weeks at least of strict avoidance. The half-life of alpha-solanine, so how long it takes your body to get rid of half, is about 7+ plus weeks. It can take quite a long time because your body can't break it down. It can just slowly excrete it. Alpha-Solanine can also, it inhibits vitamin D absorption, and it actually leaches calcium out of your bones, like my dad mentioned in regards to the cows, but then it can deposit the calcium in joints, leading to different types of joint pain.
And also into arteries.
Yes, it can lead to different plaque buildup that a lot of the times can be from solanines. It can also cause a lot of other different mood, like I said, autoimmune, inflammatory. I know for myself, if I eat a lot of nightshades, I get a lot more musculoskeletal pain. I've had patients that have 6 or 7 bowel movements a day, IBS, and take them off nightshades and all bowel movements return to normal. I've seen a lot of skin conditions, psoriasis, eczema, things like that, where if you go off the solanine foods, then things will clear up. Some people, after you completely avoid for a long period of time, they can reintroduce slightly and do okay. Other people basically need a complete avoidance for the rest of their lives. And it can be a challenging thing because if you think of tomatoes, potatoes, eggplant, paprika is in a lot of different things. Cayenne pepper, spicy peppers, different things like that. Goji berries, ashwagandha. There's a lot of different nightshades. And like you said, they do have beneficial properties for some people, but other people really need to be strict and stay away. Otherwise, it's going to be creating that inflammatory cascade that can cause a numerous number of symptoms in people.
There's some research suggesting that eating hot peppers will increase intestinal permeability, so cause leaky gut, which I assume is from the nightshades. I don't remember exactly from the research. But when I started researching this and being an applied kinesiologist, I was trying to figure out, were there some foods that were helpful in this condition, helpful either by facilitating excretion or maybe minimizing some of the more harmful effects. And this was early on, and this resulted in our product TheraSupreme. And it seems that TheraSupreme, beside being a great antioxidant, also for some people that are nightshade sensitive, it allowed them either to recover more fully, more quickly when they decided to go off nightshades, or it allowed some people to eat some nightshades without all of the repercussions. And again, what we're talking about is not like every case of IBS or every case of eczema is due to nightshades, but it can be worth it on yourself or your patient to do some avoidance just to see what would happen if you are experiencing any of these things, especially joint pain. But again, it requires reading labels. There are things like hot dogs, and most of them have paprika in them.
Hummus, most of those have paprika.
If the label says spices and doesn't say what spices, you have to assume that one of them could be a nightshade. You know, most curry has red pepper in it. You know, there are so many different things. So you can eat sweet potatoes. So it's not really that hard, but it does take a little bit of a learning curve so you understand where it might be and how you might be getting it into your diet. But it has, again, done tremendous good in a lot of the people that we see.
Next, kind of in terms of joint pain, so again, the solanine family that's probably the most common thing that we'll see to go along with that, but we have been researching and working with patients lately with some oxalic acid issues. Oxalic acid overload can cause, or bioaccumulation can cause a lot of different symptoms depending on the person. Joint pain can be a very big one. Also, pain with urination, that can be a common one. It's a different timing compared to a UTI, but we have had patients where that's helped bladder pain, urination pain, joint pain, kidney stone formation. That's also another big one with oxalic acid. And when it comes to oxalic acid, you have two different ways basically that you're being exposed to it. You're going to have it from foods that you're eating. Certain foods are much higher in oxalic acid. You can look up a lot of different resources online for what has higher versus lower amounts. There's actually a decent amount of research because of its contribution to kidney stones. But Some of the highest ones are going to be chard, spinach, beet greens,
Rhubarb.
rhubarb. Those are some of the highest ones. There's a lot of others that do have a decent amount of oxalic acid also.
If you have an Android phone, there's an app called Oxalic Counts. That's one of the best. I don't believe it's on Apple, but I know Apple has some others.
Some people they found that have higher levels of a certain bacteria in their gut, they actually degrade oxalic acid about 70% faster. So depending on your gut microbiome, you might be less prone to having any oxalic acid issues. So people that are prone to kidney stones generally have much lower of that form of bacteria. If you have aka leaky gut or increased intestinal permeability, then that's going to actually increase your bioaccumulation of oxalic acid. So if your gut's off, and your gut can be off from eating certain pro-inflammatory foods like alpha-solanine or gluten or things along those lines, but also it can be caused by different infections, parasitic or fungal or bacterial. Those can all increase your increased intestinal permeability, and that'll lead to increased bioaccumulation. Also, if you have any type of candida or yeast or fungal infection, that will actually increase the production of oxalic acid. So I'd say actually a lot of my patients I see with elevated oxalic acid levels, it's actually secondary to a fungal or candida infection, and if you treat those, then the oxalic acid levels return to normal. And I see that more often, but I do have some patients where I've had to remove downloading the app and just basically removing all oxalic acid from the body or from intake to try to lower the levels enough. There are certain supplements that will help a lot with oxalic acid, either with preventing production or helping break down into secretion. Uva ursi is probably the most commonly thing that I used, and that actually, it's interesting because it's really good to help excrete oxalic acid, but it's also a very potent antifungal herb. So you're kind of killing two birds in one stone in a sense by doing that.
Antibacterial for UTIs.
Yes, also my most commonly used thing for any type of UTI. In addition to uva ursi, well, that's probably the best herb that I've used. Magnesium or calcium citrate, that sometimes will help with excretion. Pyridoxal 5-phosphate, alpha-lipoic acid. Takasumi. Those are some of the others. A lot of people will treat the fungal issue, like I said, and things will normalize, but in other people, we really need to be strict to get it out of their body. Some people, I see this as very rare. Some people will flare once they stop eating or consuming oxalic acid, because it's like their body will then start dumping it, and it'll cause a big increase in symptomatology. I have had one patient that had that, and then you just have to stay on top of them, working with them to balance things, and they'll do really well. But we generally don't see that as an issue as long as you take it at the right path.
One thing we've seen recently is we've seen an increase in oxalic acid issues in patients over the years. And part of that is due to the popularity of green drinks. We've had a couple of people, one friend who ended up with kidney stones due to an increased intake of green drinks, one patient who was a center on an NFL team. He wasn't very injury prone, and then one of his teammates got him into green drinks, and then he started having problems all over the place.
We're talking like a pound of spinach a day.
This is mainly from the spinach in there. If you keep it to chard and cabbage and lettuce and things like that, it's not as problematic. But when you put in the really high oxalate foods, especially spinach, you can really tip the scales. So you have to be careful with those kind of things.
Cooking and boiling can help decrease the amount of oxalics in some foods, but not all. That's why, like, if you're cooking some certain foods, like out here in Hawaii, like taro, you don't just boil it and then eat it. You boil it, you pour off the water, you boil it again, because that will then help lower it. My wife ate some taro that wasn't quite cooked and drained properly, and it felt like fiberglass basically going down her throat. And that was from larger oxalic acid crystals because we didn't cook it properly. But again, if you cook it properly, it won't get rid of all of it, but it will lower it.
If you do your own research, there's what's called soluble oxalic acid and insoluble oxalic acid. So that'll help you understand that. A couple of points for physicians before we continue is, one is if you go on, I have two different websites, but if you go on my doctor website, which is michaellebowitzdc.com, and you go into the research papers, there is one on solanine toxicity, And then there's one I co-wrote with Noah on oxalic acid, and it'll give you a little bit more details on the academics and on some of the clinical findings that we had. Also, if you're an applied kinesiologist type physician, you have to realize when it comes to, say, both the nightshades and the oxalic acid foods, that is pretty common that the people do not show up when you test the food itself. For instance, you might not get a positive test on spinach, or you might not get a positive test on tomato. You actually have to test the toxin itself, because something like tomato, even though the person might be overloaded in solanines, they might be deficient in lutein or vitamin C or vitamin A, and they kind of balance each other out, and you'll get a false neutral test. So without testing the actual toxin, you might miss this as something relevant in your patient. The last topic is prostaglandins. And not going into too much detail, but there are pro-inflammatory prostaglandins or anti-inflammatory prostaglandins. One of the most well-known anti-inflammatory, pro-inflammatory prostaglandin is prostaglandin E2. My friend and mentor, Wally Schmidt, I give a lot of credit to him for some of the initial work that he had done with prostaglandins, and way back in the late 80s, I piggybacked on some of that. And it can cause inflammation. A prostaglandin imbalance can cause inflammation anywhere. One of the key ways to know is if you or your patient is helped by taking prostaglandin inhibitors. So you have a headache, and aspirin or ibuprofen really help because they're prostaglandin inhibitors. That's a really good sign that you have a prostaglandin imbalance. And if you're not helped by those things, the chances of imbalance are a lot less. The imbalance can be due to a lot of things. It can be due to some nutritional deficiencies, like if you're low in omega-3s, you might have a prostaglandin imbalance. It can be due to a food. Eating a food that you're sensitive to can cause a prostaglandin or a leukotriene imbalance. Being exposed to chemicals at a level more than your body can easily degrade them can cause a prostaglandin imbalance. Having certain microbes in your body, certain fungi, certain pathogenic bacteria, etc., can also cause a prostaglandin imbalance. So what we typically do is we try to, number one, eliminate foods that will stop your body from making anti-inflammatories. The two most common ones are refined vegetable oils and alcohol. So both of those will stop your body from making, at least partially, from making anti-inflammatory prostaglandins. So we usually have people take those out of the diet. You know, we might or might not decide to supplement some form of substance that encourages your body to make anti-inflammatory prostaglandin. You know, something like fish oil, something like borage, or even primrose oil. Sometimes they work well in a lot of the people we see that are pretty complex with lots of food sensitivities and lots of microbe issues. They don't seem to work very well. The other thing we do on a temporary basis, which gives which helps the body rebalance, but you're doing the more causative things long term. So at the same time, you're finding out what foods you can't tolerate, you're finding out what microbe imbalances you have and dealing with those. But some that are just helping to balance prostaglandins by blocking some of the pro-inflammatory ones can be rosemary. Rosemary does a good job. Japanese knotweed does a good job. And Malia does a good job. Some of the other products that we have also do, but these are probably the strongest. And also because they have other beneficial properties, like Malia is a great antimicrobial. Japanese knotweed can be a good antimicrobial. Rosemary can help balance hormones. They can be very good things on a temporary basis while you're doing other things for long-term balance of prostaglandins. And prostaglandin imbalance definitely beside joint pain, definitely headaches and other forms of pain. So, between solanines, oxalic acid, solanines and nightshades in general, the neurotoxins in them, prostaglandins and oxalic acid, those are probably three of the most common reasons for joint pain from a biochemical standpoint that we see almost daily in our practice. And they are things that, if you try to deal with them yourself, or if you're a doctor here and you look at those issues with patients, it'll help you in your clinical results with people, and also just feeling better.
If you guys have any questions, feel free to email us. Our email address is below. Also like our YouTube channel and check out our other videos, and thank you.